After reading Mr. C's history, an intervention that I think might be helpful for Mr. C would be to be screened for depression. I would worry that since he feels that he has no ambition and has had a recent change in activity, despite the worsening of his conditions, I would want to see if Mr. C feels that he is depressed and whether he might benefit from counseling or antidepressants. I also think that Mr. C would be able to benefit from physical therapy and occupational therapy to help him make modifications to his activity of daily living and to help him maintain strength as much as possible. The patient and family teaching that would be essential would be determining the safety of Mr. C and his wife. I would want to talk to them both about their comfort level with Mr. C's ability to take care of himself and whether he needs help from his wife and whether she's comfortable providing him with that help. And then if they were feeling like they might need more help, we could see if home health might be a potential option for them. For cultural considerations, I would want to make sure to ask Mr. C if there are any cultural practices or beliefs that are important to him and his family that he would like included in his care. I would want to ask about any spiritual beliefs that are important to him, and then I would want to find out if he wants family included in his care or if there are any other practices or important things for him. Asking Mr. C about his culture and the practices that are important to him would be a good way to make sure that we can include the things that are most valuable to him. In terms of long-term planning, I would want to ask Mr. C if he'd be open to making an advance directive or if he would be interested in sharing his wishes with his wife and his care team so that they can make sure his goals and his wishes are met. I would want to talk to Mr. C and his wife about where they would like his care to be provided, and if there's a certain point at which Mr. C or his wife wouldn't feel comfortable with Mr. C being at home and would maybe want him moved to a inpatient facility of some sort. In terms of discussing hospice with his physician, I would want to make sure that I knew Mr. C's wishes so that I could advocate for Mr. C and explain the reasons that he and his family might benefit from hospice.